Hello everyone, I am Dr. Ashwini, Infertility Specialist, Ferty9 Rajahmundry branch. Today I want to discuss about what do you mean by. So many patients will be asking me about what does blockage of fallopian tubes mean, madam. So is there any signs and symptoms of blockage of fallopian tubes? So usually patients will be coming and asking this question regularly. As such, according to that, are there any signs and symptoms for the blocked fallopian tubes? As such, there are no symptoms for blocked fallopian tubes. So usually fallopian tubes are something which arise from the uterus. So they are present above the ovaries. So usually they are not visible in the ultrasound. So as such, what is the importance of fallopian tubes? Why should we know whether the tubes are open or blocked? So the important thing is the fallopian tubes fertilization happens where the egg and sperm meets. So the fertilization happens, and if there is any blockage of these fallopian tubes, so the pregnancy to get naturally is almost zero, or I can tell you that it is zero. Both the tubes are blocked. So what are the causes of blocked fallopian tubes? So before going to what are the causes of blocked fallopian tubes, so apart from the signs and symptoms, which I have told, there are no signs and symptoms for the blocked fallopian tubes. Apart from that, sometimes if the patient has any signs of infections, they might experience some mild vague pain. So this tells us that there is some kind of infection at the uterus or at the fallopian tubes. So these are the very vague symptoms which I can tell you that there might be signs and symptoms for blocked fallopian tubes. So coming to the next one, what are the causes of blockage of the fallopian tubes? There might be natural, like a mucus plug, there can be some mucus plug, so it just deposits there. So if there is a deposition of the mucus plug, so it is not a very hard structure, or it doesn't cause any apart from small blockage. This can be relieved and treated by just doing small SSG or sonosalpingogram or HSG, sometimes by pushing the dye. So the tubes might get open if it is a small mucus plug. But still, apart from that, if there are any other blockages which are caused by other ways, like if there is a chronic infection like tuberculosis or any other infections, acute PID which was not treated at right time, it may damage the tube permanently. So this kind of scenario we can see in chronic PID. So in chronic PID patients, we can see the tubes are first involved, usually by the infection by the chlamydia and gonorrhea. They just directly hit the fallopian tubes and they cause permanent damage to the fallopian tubes. So at this juncture, what can we tell the patients? So one thing I can tell you, that if the couple comes, or if the female feels a vague pain or fever, or any kind of pain during intercourse, so better to consult a gynecologist. So we can know the symptoms and signs early, we can treat the infection as early as possible. At the same time, treating the partner is also important, simultaneously treating the female and male partner, so that what we call, we can just make the fallopian tube not get permanently damaged. So in this way, if a couple has this kind of symptoms which I have just told you, so they come to the gynecologist, we can just treat them with the course of antibiotics, both the partners, and treat them. Then it need not lead to chronic PID and permanent damage of the tubes. So what next? If their tubes were permanently damaged, how can we know? So if the tubes are permanently damaged, then means they'll be infertile. There is no chance of getting pregnancy. And sometimes we can confirm that by doing a scan. In scan, there are the tubes which are swollen. We can see that is known as hydrosalpinx. It can be diagnosed in a scan. Then it means the tubes were blocked and the function is lost. In that way, better to go for further treatments, and getting natural pregnancy is almost less. So what is the treatment for this kind of individuals? Better to go for IVF, in vitro fertilization. So before that, going to that, fallopian tubes has 4 parts. One is infundibulum, ampulla, fimbrial part, and the interstitial part. These are the 4 parts of the fallopian tube. If the block is at the proximal part or the nearest to the uterus, if there is a block, then it can be easily relieved and it can be treated by doing a laparoscopy and relieving the blockage. But if it is distal part, that is fembrile part or ampullary part, then it is difficult and better to go for, if there is a blockage, it was diagnosed, then better to go for further treatments of in vitro fertilization. So this is briefly about today about the blocked fallopian tubes. If you have any other doubts, any queries about the blocked fallopian tubes, you can come and directly consult me. I will be available at Rajahmundry branch. Thank you. Thank you so much.